This workshop was on cross-pollinating, agro-eco-human health perspectives to reduce antimicrobial resistance. Kim Himstra was chairing and Aurélie Benoit was facilitating. So they were the more active members from this three-member group here. And I was the rapporteur, but we've joined forces for this. We kick-started the workshop by having two very good presentations. One by Katrin van 't Hoofd on international exchange for reducing antibiotic use and antimicrobial resistance in dairy farming, and it showed the very important collaboration and, if I may say, transdisciplinarity in action between countries, Netherlands, India and Africa, followed by a presentation by Serge Moran, whom you all know because you've heard his presentation this morning, also highlighting the antimicrobial resistance and why Southeast Asia and China. We also had, I'm not sure how to pronounce the surname, Jean-Charles Carit, sorry, where is he? He's somewhere here anyway, from the EU Agriculture Research and Innovation. And he gave us also an important presentation regarding the contribution of the EU Commission in all this, and obviously very important to know what is cooking in the EU, basically. Okay. After this, we actually had different ideas that we color-coded into, as you see, the various stickers, where we did a stakeholder analysis, we did a processes analysis, then an obstacles analysis, and finally the solutions. Okay? And as you can see, we started off with a number of stakeholders, which is a long list. And indeed, it showed the importance of having the involvement of so many stakeholders, starting from policymakers, going through the people involved in veterinary science, in human health, food science, academia, last but not least, the consumers and the patients, economists, social scientists, bioinformatics experts, etc. So basically, we kept on adding, and people were in the workshop were coming up with ideas, but we need to involve also the town planners, the land management users. We need to also differentiate between the various types of farmers. So obviously, also we wanted to emphasize the importance of the economists and the importance of having the social scientists also involved. So the next part was the processes analysis, where obviously in all this, the big challenge is sustainability and resilience. Here, when we were referring to resilience, it was a word that, sort of a construct that can be used by various stakeholders. If we look at the economists, they talk about sustainability and resilience from an economic point of view. If we look at resilience from the veterinary science, we're looking at resilience from how they can be resilient in terms of the health and therefore not to use antibiotics. So the discussion was quite varied in that regard. The importance of education, and education starting, catching them young in veterinary schools, in medical schools, and moving out from the comfort zones that people seem to feel to be in till the present day in education, okay? And therefore moving more towards interdisciplinarity and being aware at least of the existence of other disciplines. Communication, knowledge sharing, and It is with regard to which strategies should we use when we are communicating, when we are sharing knowledge. And also in the presentation that Katrin showed in the morning, also transfer of skills, not just sharing knowledge, but even transferring of skills. An important aspect, an important process that came up repeatedly was also trade, which it's basically in trade, medicines, milk, food, etc. Last, with regard to processes, regulation, rules for antibiotic prescription by all prescribers in human and animal health. These were obstacles.
Yeah. Can I get the microphone?
Mm-hmm.
So I can maybe also do it with my own voice. You can hear me if I speak loudly. Yeah. So what we did is based on, now I can reduce my voice, thank you. So what we did is based on each other's individual experience, list issues that they experience in terms of obstacles of collaborations across the three perspectives: animal health, human health and environmental health. And to not repeat all the cards, but some issues were mentioned, like data came across, data, lack of data, quality data, not only quantity but also quality of data. Issues of policy, also one contribution saying that we are all policymakers. It's a shared responsibility. It's not always look at the top that those are the policymakers. We have to be engaged and see policy making as a shared responsibility, but also a card indicating that policy is not, it's the same aspect, not reflecting often the understanding the practical situation. So the One Health discussion is very much at the policy level, at research level, but at practice there are also examples, developed alternatives that should also get policy attention. I think the others were, education was also mentioned. So the others were already introduced by Sandra. So then from those, even when people listed an obstacle, we asked them also to reformulate it in a supportive action. And that is where Aurélie can come in.
And then the supportive action, I will be very brief because we will not go in details, but there will be a report. We had clusters or categories of actions that were proposed in order to promote and increase the interoperability of data, building some network to share data, to propose data mining, to get also open platforms collecting data, because there is really an issue about lacking data and quality of data. Then we had others, proposition of actions addressing networking, so networkings among alumni, students in One Health curriculum, but also among universities, and networking to bridge universities with field actors, with society. And also the issue of science policy, science interface, with setting up some platform to exchange data. So there was really a focus on communication and networking in terms of the proposition for actions. And also what was highlighted during the discussion and proposed actions is about the environmental dimension of antimicrobial resistance. That of course a lot of data are missing for animal health, human health, etc. But also regarding the socio-ecosystem approach, regarding environmental mechanisms that are involved in immunity or in resistance emergence. And so more research really on this specific health ecology topic. But also on the economy, because beyond the mechanisms of resistance, if you want to propose some management of the resistance and new practice, we really need to take into account the economical dimension. So some propositions of research in fields that are not the comfort zone for antimicrobial resistance, so no public health and animal health, but rather economy and ecology. I think that's it.
Okay. Thank you.
Thank you.